and together we must strive harder to defeat it. Babajide, I told you, I pointed out yesterday when I saw that worrisome trend, the oil prices of the international community. It was hovering between $20 to $25 per barrel for Nigeria, and I saw the United States, their own oil was selling for, I think, $19 per barrel, and I was now looking at post-COVID-19 that it's really going to be very, very challenging for our own economy.
It's a terrible situation that we find ourselves in. On exactly April 20th, the price of Brent crude was $11 a barrel. At that price, it is not even $11. At that price, you can't cover the production cost.
Production costs?
Yes. You need double that price to meet the cost of production. So
anything
and in spite of that, even in spite of that, nobody's ready to buy. Nobody's ready to buy. That is the reason America's shale oil itself, the price collapsed to a record low, because coronavirus has ensured that industries are closed, airlines are grounded. These are the people who consume petroleum products. China, that is seen as the production capital of the world, how many of its industries are rumbling at this time? How many? So you have a situation in which Nigeria's crude is in different vessels on the high seas, and nobody wants to buy. Unfortunately for us, we do not even have the capacity to store our crude. So you now store them in vessels. Those vessels are floating on the high seas, and you pay for every day that.
So we are hawking our crude oil. Come and buy.
There is no one to buy. It's not peculiar to us alone. It's not just a Nigerian problem. It's a global problem. How many of the industries are working? The first challenge that the world is facing is to defeat the pandemic. Nobody has time for any other thing. That's why President Trump is worried that we must kick again. But how do you do it? If you do that too early and people begin to die, you lose control. At that point, people will blame you. So it's only in a few states in America where the pandemic is not really a big problem. States like Ohio, for example, they are saying, okay, May 1, we can begin to open the economy. Tennessee, they are saying, okay, April 30, yes, people can begin to go out, go to work, So, but across the country, across America, the economic capital of the world, the problem is a big one. And so where are you going to whom are you going to sell your crude oil? So it's such a big problem now. It's such a big problem. I'm not surprised that this is what we have. And the challenge for states, because the president has decided to release money from the Sovereign Wealth Fund to help the states. But even the states will only access that money in the month of June. He's trying to help them. But how much longer can he do that? We are even seeing a situation in which the price has gone down lower than when the president took that decision. Very soon, if he cannot do it again and again, because we will even run out of funds in the sovereign wealth account. So this is the problem.
Solomon, we predicated the 2020 budget on $57 per barrel. Now we found ourselves in this kind of situation, and it was so funny when people, in Nigeria, we've been saying that there's hunger in the land, especially those areas we have lockdown, Lagos, Abuja, and Ogun, that the hunger is biting harder. As I'm talking to you now, Somebody, I actually read it in a report that New York City right now, there's hunger in New York City because they've not been able to work, they've been on lockdown, and so many things are upside down, that there's hunger in New York City, in spite of New York being the epicenter of coronavirus in America.
I'm surprised we are still talking about the budget. We are in an existential situation at the moment. The truth is, when you can't produce and you can't sell, the next thing you do is that you spend the one you have, because you have shut down the economy.
That's as if you have.
Well,
If you've kept,
somehow,
you've saved.
somehow, that is the only option here. I don't know how you are going to go about it, but the truth of the matter is that you have to start spending. Whether you have little, whether you have much, whether you don't have at all, you still spend. And the world economy, generally, whether it's on lockdown, shutdown, whether it's on production or not production, is built on a credit facility. It's a credit guarantee, with the hope that the world will come out of this problem. But the truth is, I wouldn't be talking about the budget at this time. We cannot also shut down the economy or lock down the country even on the short run. So let's not even talk about the long term. We can't even do it on the
We are like
on the
in a
long
state
run.
of emergency right now.
So the challenge is, there has to be projections. There has to be a model of, okay, how long could we stay on a lockdown, and how can we, within the time we can stay on a lockdown or a shutdown, how long can we quickly, or how quickly can we build the capacity to be able to deal with what's on hand? I think that that's where the real issues are. You know that you have to shut down. You don't have a choice, you have to shut down. But the question is, for how long can you shut down? And how quickly can you build the response capacity to be able to deal with the challenge on your hand so that you can reopen quickly? I also think that while shutting down, it is not sufficient to shut down and hope that you will be able to defeat the pandemic or be able to, rein it, put it under control. I think that the plan to reopen the economy should have gone pari passu with the plan to shut down. Because one, you may not know per se when this thing is going to stop, but you have to make a deliberate effort to stop it. And so, by the time we defeat coronavirus, what is the plan for reopening? What exactly are you thinking or talking about?
Julie, let's talk about Kano now. Now, Kano record big number. They record a big number again in confirmed cases of coronavirus. Now, Kano State Police Command arrests footballers over the breach of coronavirus lockdown order. Now, we said Kano is just like Lagos. Once it gets to Lagos,
even worse.
And the way they make contacts in Kano is also densely populated. And if it's not well managed, we're going to have a big crisis in our hand.
Kano is worse than Lagos, because the level of enlightenment in Kano and the level of enlightenment in Lagos, the level of literacy in Lagos is higher than Kano. And it is the economic capital, the commercial capital of northern Nigeria. So many people come into Kano to trade from Niger Republic, from Cameroon, from different parts of Africa. People come to trade. It's been like that since the Trans-Saharan trade era. So there's no part of Kano, except probably a few areas in Nasarawa, where you have the government house, that area. Maybe that's the only part of Kano where you won't see a huge number of people. Everywhere else you go, if you go to the city center, the crowd that you come upon is amazing. It's densely populated. Even the local governments outside of Kano. You go to some local governments outside of Kano, you wonder, there are so many people in this area. I once covered an election in Tofa village. I think I can say Tofa town because it's quite big. If you see the number of people that I saw,
That's the town of Bashir Tofa.
yes,
They call the place Tofa.
yes, that's the
Okay.
it used to be Dawakin Tofa local government, you know. Now, but today is Tofa. The crowd, I say, what? And the houses are built, you know, like kind of clustered,
Together.
close to one another.
So
You always, anytime
self-isolation is so difficult.
it's extremely difficult. And then there is heat. So people will go out. At this time, it is the peak of the dry season.
Okay, I wanted to even say social distancing.
the heat.
Let's say we want to pray in the mosque now. We want to do ablution, what they do and everything. Most of the time they do it together, water and everything. So for you to maintain that social distance, it becomes...
It's difficult. It's difficult and it's difficult. Maybe now that people are being arrested, because the feeling in Kano is, look, this thing does not exist. You can see a lot of them are saying, no, Bamuya, that corona. You do not agree that corona is here, you know? So maybe now that people are being arrested, it will nudge some of these people to believe that, look, this is a killer, and that killer has come, you know, to exterminate humanity. So I'm happy to hear that the police arrested footballers. You don't organize a football competition when we are saying keep away. And there were hundreds of people at that ground huddled together watching that match at Krona Sabe, you know. So this is it's ridiculous. And government has to address this problem. The government of
Abdullahi
Ganduje has to address the problem. The final thing that I want to say about Kano is the federal government must come to the support of Kano.
Must assist
From
Kano.
what I see, from what I hear, I worked in Kano for 7 years. I still have sources in that. Even if I don't go there, I get information. From what I see, what is on ground now requires the tremendous support of the federal government. Otherwise, we will have a big problem on our hands in
State
Kano.
government cannot handle it.
You can see the way it's going. Kano may eventually overtake FCT at the rate they are going. You know, so we need to, and the governor says, see, we need testing capacity. NCDC assist us. So it is germane that everyone jumps in to assist Kano. Otherwise, if this thing goes out of hand in Kano.
Solomon, you've always been clamoring for, you know, public enlightenment, the campaign across the board. Now I've seen the facilities put in place by the government of Abdullahi Ganduje. He's been inspecting it and everything. That means they've been preparing for this for some time now. But what we have now, the way it's going in Lagos and what we've seen so far, and we might hit the 1,000 mark by next week, in the total mark. And
weekend.
By this weekend, we might hit that 1,000 mark. And if we continue like this, I'm looking at it, can we just start this enlightenment and people will stop saying that there's actually nothing like coronavirus, it's malaria fever. And people are just going about as if this thing is something that is abstract, is not here.
I'm not surprised, first and foremost, that the situation in Kano, I'm not. I had expected it with the attitude on the street, with the behavior of the people on the street. I had thought about this, that if people generally have this sort of feeling about what the whole world has been making so much noise about, then there will be a very big problem. And this is where I always complain about the communication strategy. This is where behavioral change communication comes to play. You need to speak to the people in the language they understand. I agree that the way the world has moved, that there is quite a huge number of, a large number of people, young people, elitists in a way, upwardly mobile people who are on Twitter, who are on Facebook, who are on WhatsApp, who are on all kinds of internet-enabled media. But the vast majority of the people live in rural areas, do not have access to these things. more than 50%, to be a bit conservative, cannot operate on the level of Twitter, Facebook, and all of that. So we need to speak to them in the language that they understand. You know, when I was much younger, I used to hear of MAMSA, even though MAMSA was a federal government, parastatal, but there was something about the groundswell of information they disseminate at the grassroots level. Jerry Ghana. And this is the job of the local government. Now, if the local governments don't have that capacity, then the states have to provide this for them so that they can go from word to word, from community to community, speak to the people in the language they understand. It's not a one-day thing. It has to be continuous. As you launch on Twitter, on Facebook, on internet-enabled media, you are using conventional, transistor radios and all of them.
Clerics, yes.
You understand? Community and social structures, the traditional structures. This is where you need to employ them because you need to change people's behavior. Changing people's behavior is not press conferences. No, it's not press conferences where journalists just report.
Hold on fire there. Now, we have the special assistant to the governor of Kano State on media, Honorable Salisu Tanko Yakasai, with us. Thank you for joining us.
Thank you very much for having me. What
is happening in Kano State? It's been trending since yesterday that they had a cup called Corona Cup football competition yesterday in Kano.
Yes. We thank you very much for the opportunity. First of all, let me clear there on that. The state government and the security agencies, as soon as that report came surface, interaction and went to the area, and not just that area in particular, but other areas that usually, traditionally, youth usually go to play football matches. The security operatives took over those areas so that we do not have youth playing football. So I wish to say that that issue has been brought under control, and other measures are being taken in place to ensure the level of compliance in the state. And we have to understand that in the first initial 3 to 4 days of this 1-week lockdown, the level of compliance in Kano State was extremely good. It was one of the best in the country. I think it was after that, obviously because of the people were not used to it, because of the nature of the lockdown, and people started feeling that they need to come out and come out on the streets, especially inside the city. And this is not only peculiar to Kano State. We have seen that. We have seen reports of in Abuja, where people are coming out daily to exercise and carry out, go from one place to the other. We have seen even in Lagos State, where you have people coming out. Even before yesterday, we saw that video promotion. So basically, it's not something that is out of place to happen in Kano, but I will want to say that the state government is doing everything possible to ensure that we have enforced the level of compliance to the way it was at the initial stage, because we have done a lot of effort at the beginning, and currently the state government is equally doing a lot. We have all the major stakeholders that are also on board. We have the Emir and the Emirate Council, the 5 emirs and the Emirate Councils that are working, just as you have mentioned, the level of engagement at the grassroots level, because they have a comprehensive structure from the emirs down to the chapter level. And we're engaging them. There are several meetings that took place between the state government, the COVID-19 task force committee headed by the deputy governor, and the traditional institution. We've also seen a lot of other stakeholders, like the ulamas, that have been brought in place. For the first time in my own life, over 40 years of age, I have seen a Friday where there only one done Friday prayers. That is incredible. That is the level of compliance. And this was possible because the ulamas have been carried along. They have been informed. The decision was made with them. And that is why we have that level of compliance.
Saliu.
So we are doing
Hello, yes. Saliu, Ramadan might come. I think Ramadan is this weekend. That the fast. 24th. Yes. The fast, Ramadan fast. And I know in Kano it's something that is big. And people want to by 7 p.m. people want to break their fast. They want to go to mosque, and they do in the morning. What have you done? What have you told people to stay indoor, to actually pray in their homes?
Every day this announcement is going on an era that have been suspended. And unfortunately, there was a ruling from the Sultan of Sokoto, to this effect that Ramadan tafsirs, that lectures and the night prayers, have all been ordered to be suspended. So this sensitization is also equally going on. We have a number of ulamas that have been drafted to go on radio stations, because radio stations is the most effective and important means of communication, particularly in Kano State. These ulamas will be going on air to be able to enlighten people, and you can listen to these lectures, Ramadan lectures, on these radios that we practically play them from morning till evening. We have our 10 radio stations. So there's no need for people to go out for tafsir lectures or to go out for these prayers. You can pray at home. And we have these ulamas that are reiterating this point. And it was done with agreement with all the different sects in the state. We have the Tijaniya, we have the Qadiriya, we have the Ahlus Sunnah, and even those that consider themselves independent of these groups. You know, all of their representatives had a meeting with the state government, with the governor and the deputy governor, where they agreed that it was with their agreement that these were suspended. So we are hoping that this will continue. And what I want to add is that every person in Kano, irrespective of background or differences, should understand that the issue of the pandemic in Kano State is everybody's business, it's everybody's responsibility. If we have only Kano State, everybody is a stakeholder. You do not wait for someone to do it for you. You have the responsibility, unless, especially if you are enlightened, if you are educated, if you have the means, to educate, even if it is your neighbor, so that we can all arrest the situation, because we only have Kano. There's nowhere else to run in the...
Okay, thank you, Saliu. Listen to Jide.
Now, I observed that on that first day, this thing was very successful. I saw pictures of Kabuga, pictures of different places, and Jumat prayers were did not really hold. But suddenly, we saw that compliance that we experienced on that first day disappeared. The question is the problem really that of enforcement? Is it possible to enforce compliance in the city center, where you and I know the crowd of people is tremendous? Is it possible? Because the ulamas and other people have been engaged. What if the people choose to not, in spite of the engagement, choose to not sit in their homes? What will the government do?
Well, it's obvious now that the best thing to do is to continue to appeal, to continue to enlighten, to continue to engage people using all the different stakeholders that I've listed. Of course, like I said, you do not even have the security manpower to start enforcement the one by one in the state due to the large number of the population. You also want to have a bit of a control over the situation so that you do not create another crisis in efforts trying to enforce compliance. So the best thing to do, and the strategy the state government is doing, is to continue to sensitize and engage people, be able to bring out to the public over and over and over again the dangers that this pandemic poses to the entire city, by extension to the entire country. Because this is something that we keep saying, as experts keep saying, it does not show for face. Sometimes you'll even get test negative. You know, throughout the period that you've been affected, you will not see the results. So these are the messages that we keep telling people, that you might be infected without certain symptoms. That does not mean that corona is not in Kano.
I want to thank you, Honorable Saliu Tanko Yakosai. That's the special advisor to the governor on media, Governor Abdullahi Ganduje of Kano, telling us about what is happening and the precautions they've taken in Kano State against this COVID-19. Babajide, we're even saying it is as bad as some people that you don't even expect. Like you mentioned, like somebody like Zlatan Ibile saying that he didn't believe in what they call corona virus. I don't even know who they call Zlatan Ibile. Maybe, but I used to hear that name.
Zlatan Ibile
Okay, you too. Yeah.
is probably the best dancer around now.
Okay.
You know, those
What's his
leg walks,
any of
those
his
leg
hit
walks
music?
that you see people
Okay.
is the one who invented
Do you know any of
those
his
dance
hit songs?
steps.
Because I know Jide will.
Let's not leave it something. Because the thing is, I'm not even happy with him. So
Okay.
I can't. I will not sing his song.
Okay, but you will know.
He did an Instagram session where he was saying, "Look, I don't believe in this thing." And his colleague who was in that exchange with him was telling him, "No, you can't say this. Across the world, this thing is killing people. You can't at this level be saying that you don't believe in it." He was lamenting about his shows that were cancelled in London.
Oh.
So maybe that's what got him angry. But if
Your shows
coronavirus did not exist, nobody will have cancelled your shows in London.
You
So,
can't influence that from Nigeria to London.
you see, I keep saying it that the problem is with our elites, it's with our people who should know. Why do we have so many vehicles outside? We've started experiencing vehicular queues now, as if these are normal times. It is because the elite, including those who have no business going out, have chosen not to sit in their houses. Yeah, they expect other people, they expect the 100 million boys to sit in their houses. When you are not setting an example. So this is the thing. It's the same elite who came into the country, refused to self-isolate. They were going to private hospitals where they've been told that you are not going to get the right treatment.
And it's even an offense to take coronavirus to a private hospital.
You know,
must be at the designated
governor of
isolation centers.
The governor of Lagos State has said that those of them who lied about their travel history, that the state will expose them. I think these people deserve the shame,
name and shame,
to be named and shamed, because they have put us in this mess. Someone was saying that in places like Lekki, where all these rich people are, a lot of them, they have the symptoms. They are reluctant to go and mingle with people in the isolation center. They feel too big. So they would rather go to the private hospitals.
Okay.
You know? And when you even get to the private hospitals, you won't tell them that you
start
just
infecting
return.
people.
You start infecting nurses.
You won't give them the right information so that they can take you to the isolation center.
This is probably the most transmissible disease that I've ever known. Yet, people will not confess to caregivers that this is probably what I'm suffering from. I just came back from a journey outside of Nigeria. You will now endanger the lives of the people who are taking care of you. Look at what happened in Maiduguri, you know, because that person too has infected nurses, infected doctors and other people.
Solomon, why are we like this? I think it's not. We should not stigmatize anybody. If you have the symptoms, if you just feel you have the symptoms, drive to Onikon Stadium, drive to Yaba, and you know.
I don't think it's a matter of stigmatization in a sense. I think it's the way we are, a level of pride, a level of arrogance, class, stratification.
And you're feeling that symptoms, you will hide yourself
people,
or you take yourself to the normal hospital.
You know, but you see, there is something people need to understand about the coronavirus with the information that is coming out on this now. Very often, a lot of people do not know, because this is also not within general public domain, that gain of function is biological research. And it appears that despite all you have had, some of the information coming out appears that this is a gain of function research that has given birth to this sort of problem, you know, And when you do gain of function, it's very dangerous research, you know. And when you do this kind of, I remember when I used to visit the Nigerian Institute of Medical Research in Yaba, I used to go there often because I had friends who were in the lab there. But one lab I found very difficult, that every time it's not easy to get, you don't go near there, is the virology department, the virology lab. Because the sort of researches that go on in the virology lab, I've been asking myself since this problem broke out, Where is Naima? What the people in Naima, what can they tell us? But we are beginning to see that it seems that the gain of function that gave birth to this sort of virus, because it's obvious now that it's not just a normal virus, it's engineered, it's synthesized. The lab in Wuhan that you could talk about did not take the necessary safety precautions that have to do with things like this, because at that research level, you'll be talking about bioweapons and all of that. And so this thing broke out, whether deliberately or by accident or something. So the thing about this sort of virus is that the power it comes with is so huge. People in this generation, in generations, 5 generations ago, we have not seen anything like this. So naturally, people probably behave, oh, okay, there's nothing like it. It's not happening and all of that. So it's so powerful. It's one thing for you to argue about its origin. It's stupid to argue that it does not exist. It does exist. But I think that the basic problem with Nigerians is class. This problem of class. This point of creating impression. That's why I keep saying that I'm so impressed. I'm so impressed with somebody like Bukolo Olokpade.
Okay. Yes, former commissioner for
sports
in Ogun State, Zogula. Now, we have the Director General of Kano State Agency for Control of AIDS, Sabitu Shanono. Mr. Shanono, thank you for joining us.
Thank you for hanging out with me.
Okay, you are hanging out with us now. Okay, DG, what have you put in place? We are so interested in Kano because Kano is just like Lagos, the commercial nerve center of the north, and Kano is densely populated, and we are worried that if this thing is not handled properly, that COVID-19 might ravage Kano in a very bad way.
Well, actually, as you said, there are so many recipes in Kano that if you consider them, it means that we're actually into a pandemic, and that it means that the state and all of us need to do much to curtail this. And I can say that based on Kano State, the preparation actually started like 2 weeks before even we had the first case. We had our isolation center active and running. I can say that 2 weeks before we had the first case, our isolation center was ready, and we have even simulate in order to prepare. We have been proactive rather than being reactive. And also in terms of surveillance, we have put in place our rapid response teams, our contact tracing teams, and all those components of surveillance that are required for such a pandemic. And fortunately for us, Kano had experienced pandemics in the past that like Ebola and Lassa fever are just of recent epidemic. So we put all those in place, and we had our first case 11 days ago. And unfortunately, from the time we had our first case to today, you can see the number. And that explained that at the time we are now, it's a time where we need all hands on deck. And that is where we are getting to. All our resources within the state are being mobilized for that. Both
thank you,
human
DG.
and all others. And also,
hello, DG.
this is the time where we
I have to pause you there, DG. Yes, we are joining the live telecast of the Presidential Task Force on COVID-19 on the DSTV channel 418 station, but the program will continue on our channel. That's Star Times 307, Sky TV, and on channel 515, and on TVC, GoTel channel 45, GoTV channel 45. So for those of you that are watching TVC Terrestrial, you can join me on TVC Entertainment as we continue the program. Please don't go away. Stay with us. I still have Alhaji Shanono on the line, and tell us, what you put in place to forestall the spread of COVID-19 in Kano.
Are the isolation centers equipped? We want to know whether they are equipped to handle the situation.
Hello, Alaji.
In terms of in terms of the isolation centers, we can say that we currently have 2 isolation centers. One is at the Kano Dawaki, which is 70-bedded capacity and has all the equipment, and we have over 27 ventilators there and all other needed equipment. And that one is being reserved for those patients that will come with moderate to severe symptoms. While we have another isolation center, which is the Muhammadu Buhari Specialist Hospital, which has 100 beds, and this is being used for those that have mild and even those that are asymptomatic. And then we have other centers that are coming up, like the Dangote Center and others. And then in terms of trying to prevent the spread, one of the ways is our rapid response, trying to see we reach out to this suspect. And also, we are also trying to see how we can, what Sally was telling you, that we need to, we are trying to do more in terms of enlightening our populace, because this is something that cannot just be done by the health authority, but it is something that should be done by everybody. And I'm glad to tell you that the state government is looking at how to make sure that this lockdown has become more effective in terms of curtailing this condition.
I want to thank you.
We will also try to see that those that have been identified to be positive, we pick them to these isolation centers within 24 hours, because that will limit the spread within the community. And this also means that people need to understand that we're picking them not just because they have symptoms, but because those that are asymptomatic might be carrying the virus around and spreading it to those that may end up contracting and having a severe case.
All right, I want to thank you, Alhaji Sabitu Shanono. Thank you so much. Thank you for your intervention. Babajide, we have another good news here. Governor Nasir El-Rufai is out of danger. You know, it started from the governor of Bauchi State, and the governor of Bauchi State recovered, and the governor of Oyo State,
yes.
Recovered,
Yes.
and now we have Nasir El-Rufai recovering. You know, at the point in time we had 3 governors that contacted this virus, but the late chief of staff wasn't that lucky to have recovered from it. But now our 3 governors are back, and El-Rufai is back and good. He handled it well. Immediately was positive.
It's a good piece of news that the governor of Kaduna has tested negative, and he's done very well during this period. He showed leadership, and by imposing a curfew early, Kaduna's numbers remain low. I think one has to give credit to
Nasir
El-Rufai.
For being proactive.
Very decisive. He is what you know him for. He's never afraid to take the big decisions. He was the first to do a curfew, and other governors picked it up from there. And it was unfortunate that he took ill at that time to a virus that he clearly was determined to defeat. But as God will have it, he has recovered, and the deputy governor, Aja Balabe, or Dr. Balabe, did very well. You know,
she was the head of the COVID task force.
And as acting governor, she did very well. So I'm sure that now that Nasir is back on his feet, because we saw him even before he was taken to isolation. We saw him even going around trying to ensure that people stayed in their houses and all that. That's a mark of leadership that we know is never shy to exhibit.
He came in a broadcast, in a statewide broadcast, and said, look, I've tested positive. I'm going to isolate myself, and I'm going to go through this process. And today he has defeated the deadly virus.
He did not only do it in a statewide broadcast. He did the same thing Bukola Olakpade did. Take a recording of himself with his phone, place it in, it was trending, it was all over the place. So it wasn't just a TV broadcast. So you could find it everywhere. And there was no reason to be secretive about it.
Yes.
It's also part of the leadership that this happened, so this is how we're going to deal with it. And then the people know that, okay, this is the way to deal with it. The good thing, it's not a good thing that somebody gets struck by an illness as devastating as this. But the good thing is that having tasted this, having been a part of this, they now know how important, they will know how important it is to take the battle to the gate of the virus and know how to defeat it. With this now, I expect that these governors who have tasted of the fang of this virus will then step up the medical facilities and infrastructures in their state to prepare for odd times like this. We may not have another virus of this nature in another time, but there are other illnesses to deal with. Some of them can escalate to epidemic levels. So it's good that they have recovered. It is also important that having recovered, then it will be great gain for their states. This is very important. I was happy particularly when I also met Bukola Olakpade over the weekend. I met him over the weekend and I discussed with him. And we talked about the isolation center, the experience, and it was sort of a very dangerous mission for me as well, you know, because you had to stay very far away, you have to, you know, and then they talk about, oh, he has to stay a couple of days, a very long time before you can even start interfacing with him at that level, you know. So it's a good thing that people are recovering, and that the people who are recovering are in a position to influence better management, better governance in our health sector.
Now, we've experienced a couple of police brutality in the quest to enforce the lockdown order, you know, and I've gotten complaints from several areas. A friend of mine was talking about one Lawal. Let me see if I can get the real name, but he's a blind man, and he was trying to make his way, and he was beaten. He was brutalized.
They expected him to run.
Expected him to run. He didn't run because he was visually impaired.
Yes.
His name is Kazim Lawal. Kazim Lawal was brutalized in Abuja, and blood was gushing out from his face.
At the last count,
yes.
At the last count, the police had killed 19 Nigerians during this lockdown.
19?
Yes. They had actually even killed more people than the virus had killed at that time.
More people
at the time
than the virus had killed at that time.
Yes.
So
now, if the IG has descended on his men and decided to put some of them on trial, we saw the video of the woman in Iwo, Osun State that was being flogged.
Like
so
a baby.
I asked myself, I said, what in the world could make policemen be flogging a woman in this manner? I mean, you ask yourself that, what is wrong with our policemen? You know clearly that some of these policemen do not deserve to wear the uniform. Because you can't be flogging a woman like that.
Some of them are meant to go through psychiatric evaluation. Yes, because I don't know.
Mental evaluation.
Because how are you going to just carry a cane
and start flogging not adults? One of them, a woman. You know? And any little thing, the policeman will just reach for his gun and shoot people. Look at the one in Abia. That the IG has just, the Commissioner of Police has removed the IG has removed the Commissioner of Police.
Okay, this is the woman.
Look at the woman. I hope we can see how she's being flogged.
How?
Can you imagine?
How? I didn't get it.
Can you imagine?
She wasn't resisting them.
Yes.
They were just flogging her.
She was not violent in any way. She was trying to pick, you see her trying to pick her phone. Also. You're just flogging it's not as if she's fighting back. You flog a woman, something is wrong with you. This is the thing. Now, look at the one in Abia. I think one vehicle hit them in error. And then because of the argument, a policeman just went for his rifle and shot a businessman to death. So the IG has removed the Commissioner of Police in Abia and replaced him with a female Commissioner of Police. But it's not enough. Wherever policemen behave in this manner, even their bosses should be punished.
Yes.
You'll be punished either by demoting them,
These
or doing
particular
something.
guys should be made to face the
No,
full
they've
weight of
already
the law.
they've been arrested. I know that they will be dismissed.
And they are going to be
One
prosecuted.
good thing about the
They
police,
must be
you
prosecuted.
may say so many things about the police.
Yes.
But I don't know any other Nigerian establishment
They don't shield their own.
that purges its ranks.
Yes.
That purges its ranks of irresponsible elements the way the police do. So we must give them that credit.
So
the
this
IG
happened
has
in
moved
Osun?
in. Yes, in I think Iwo in Osun State, flogging a woman.
This is
You've killed 19 persons.
So-
So you are faster in killing people than the disease
than
itself.
coronavirus.
Unprovoked, unnecessary killing. Sometimes I wonder how we use how taxpayers' money, people who are paid from the public purse, turn against the same people who pay them. Because when public officials realize that it is the public, it is the Nigerian people that pay them, when they realize that they are servants of the people, then they will not maltreat the people this way. Sometimes I wonder when I'm in a tight situation and I'm on the road and the policeman is supposed to be my friend. The police is supposed to be the one I should go to when I miss my way. The policeman is supposed to be the one I go to when there is trouble around me. But then I'm afraid to go to the policeman to ask him for anything because I feel he will take advantage of me or oppress me because he's putting on the uniform. It's
They
a
see
very,
themselves as superior.
it's a very big problem. And I think that we need to look at the police force again. They call it the police force. I thought that at some point we had removed the force from the police, but then it seems the force
still
keeps
Nigerian
going there.
police force.
I
Don't
think
know
that
about that
also we
subject.
have not restructured the police to jettison, to remove the vestiges of the colonial era of we versus them. You know, so the ruling class in this country just kept that system, you know, so that until we do a proper restructuring where the police force, the uniformed services are answerable to the civilian population, we're not going to really gain plaudits for anything.
So, Judy, the Inspector General of Police, we are calling on him again on all these cases, and as we know, he doesn't shoot.
All these policemen should pay for their irresponsible conduct. You can't be killing people. There are ways by which you can use your rifles, the weapons that they're giving you. You can't be killing people like that. We are not at war.
We're not at war.
But we're at war against
But
coronavirus.
you know what I'm saying. If you want to fight a war, go to the northeast and Facebook. Not innocent people.
Flogging Professor Solomon Ajozugu. Thank you so much for being part of the program.
Thank you for having me.
And the master himself, BKO, Babajide Kolade Otitoju.
I
Thank
greet
you
you.
for always being there.
Let's
And that's our
hope
offering
our
today.
policemen will be